public health. I think there's a misunderstanding of what or how it's going on with regards to that issue and the topic of it. And so we wanted to clarify a few things about that before we get started, just to put everybody at ease, because there's some things we may not really need to talk about because of some type of misinformation or some other things that have been circulated out there, and want to put everyone at their ease with that regard. So I'm going to turn it over to my vice chair real quick.
Thank you, Mr. Chairman. Starting last evening, we started getting an infiltration by the masses of emails saying fully fund the Department of Health and avoid the governor cutting $21 million out of the Department of Health. I think that there's really some misunderstanding there. So this year's budget is their exception budget. The governor has supported. Okay. Now, when we go through the budget process, then the Department of Health comes in with exception requests, exceptions to their standard budget. And we look at all of those. This year, there's exception requests for, in a variety of those divisions, for about 186 million exception requests. And I'll explain a little bit about them. The governor then goes through, he presents his budget to us in the Department of Health, and he goes through those exception requests and say, I recommend accepting or I recommend denial. So of the 186 in exceptions, he's recommending denial of 21 million. Okay. We'll then go through as we mark up and look at those we can accept or reject and modify. What we've had to do with the Department of Health this year is, if you recall, when back in the 2021 session where we had to make some really significant cuts, we refer to them as the step 1, step 2 cuts. We cut about 142 million out of the Department of Health, which this body and our colleagues determined it was too much. So then we come back, we had CARES money, you'll recall was the federal CARES money, and then followed by some ARPA money that we could use one time. So we had made cuts out of their budget. Ooh, not going to fund Tom anymore. We pulled that out of the budget. But then upon consultation, we felt like that was cutting too much. And so we used ARPA dollars or CARE dollars to fund Tom over the last biennium or 3 years or so. But those were one-time dollars. Okay. And so those dollars are gone. And so this year, what we've had to do is then look at those cuts that we had funded with one-time dollars, a lot in mental health, a lot with our DD providers, a lot with in Medicaid services that we had funded with one-time dollars. And now we're putting those back in the standard budget. So I think in the comments we've received that says the governor's going to cut the Department of Health budget by $20 million is just incorrect. Okay, we're just in the process of developing the budget, and when we're now putting back in 186 minus 21, 160 million back into that budget, I think would be hard to argue that that's a cut. Okay, so as you contemplate coming up and expressing your passion and support for the Department of Health, know that this committee, and we've worked very hard over the interim to understand how we make sure that nursing homes are getting 100% of their reimbursable costs and restoring the 2% Medicaid provider services and making sure that the funding that we put into the DD providers stays there. So, just contemplate that. As you see the masses here, that maybe this isn't the sky may not be falling is all I would say, Mr. Chairman.
Yeah. Well, we're adding on the governor's request at least $160 million back into the budget. John, I'm going to start with your crew. Could you bring them up? Because I just know who you are, and I know we know what the subject is, and I've already expressed our concerns with you directly. So, and so I'm going to limit everyone to no more than about 3 minutes apiece, because I'm just adding the people and I'm counting the minutes of time. So please identify yourself, tell us what you're talking about, and And fire away.
Thanks, Chairman Nicholas. Members of the committee, thank you for the opportunity to be here. My name is John Conrad. I'm a representative for House District 19. And I want to thank you for the opportunity specifically to comment on the Department of Health's budget as it relates to, in this case, the capital construction. Specifically, I'm referring to page 70, where it denotes a pre-engineered metal storage building replacement and demolition currently authorized at $3.4 million. Respectfully, I am acutely aware of the energy, the time, and history of what has led to this present plan of demolition and the labors of this committee. I respectfully ask in this consideration for your favorable consideration that this metal building and demolition be delayed for 1 year to enable the citizens of Evanston and members of the Uintah County to present to the Department of Health new information, new people, and a viable path forward for the preservation and the restoration and repurposing of this campus for economic development opportunities that are critically needed, specifically in Uintah County. I appreciate your consideration in this 1 year delay that will prove the legitimacy of this effort. Thank you.
Thank you. Go ahead.
My name is Jim Davis. I'm from Evanston. I'm a former city employee. I worked for the city of Evanston for 27 years. Currently serve as chairman of the Evanston Historic Preservation Commission. I'm here to ask that in Evanston, we have a pretty good track record of being able to rehab buildings. And the campus of the Wyoming State Hospital, the buildings that they're vacant now, provide tremendous opportunity for not only Evanston, but Uintah County and the state of Wyoming. I've had the pleasure to work with local citizens to rehab the Roundhouse and Rail Yards in Evanston, Depot Square, the 1900 depot that was vacant for many years. I also worked on Strand Theater that was built in 1920s. It was burned. We were able to put that back together. So we're confident with the experience we've had in Evanston and rehabbing historic buildings that we can do it. We can build consensus to get the job done. Those buildings that are currently there, that are vacant on the campus, are in much better shape than the buildings that we worked on when I mentioned the Roundhouse and Rail Yards, the depot, and the Strand Theater in particular. Those buildings have been taken care of by the state of Wyoming for many, many years. They had full-time electricians, carpenters, and painters that took care of those buildings, and they create a great opportunity for us. They can be a benefit to our state again. Thank you.
Thank you. Appreciate it. Go ahead.
My name is Jesse Lind. I am a freshman city councilman in the city of Evanston. So I'm a little bit new to this. Regarding the capital construction bill, I respectfully request that the committee deny authorization of the $3.4 million from the Wyoming State Hospital Demo Account Fund 457 for the Wyoming State Hospital pre-engineering metal storage building replacement and demolition until next budget cycle. This request is found on pages 69 through 71 of the CapCon budget. Instead, direct the Department of Health to work with the City of Evanston, a local economic development group, to develop the RFP for a feasible reuse and rehabilitation plan that could provide affordable housing for nurses or spaces for new businesses in the southwest corner of Wyoming. Speaking to these buildings and the opportunity we have for the economic development that could occur in these buildings, whether it be housing, whether it be businesses, is directly related to some of the other economic development things that could be occurring around our southwest corner of Wyoming, from the Terra Power project to the off-track bedding new building that we just had a meeting with the other day. So many different situations where we're going to need housing, where these supplemental businesses could build off of these other businesses. If you've known, southwest corner of Wyoming has been very economically deprived. I mean, our populations have dropped. We're in a situation where we need economic development. We need more jobs. We need more growth. Our largest economic driver sitting in the southwest corner of Wyoming is government right now. It's not private sector jobs. We need to add economic development, and these buildings could be a part of those other projects that are going on and could be supplementary, could help, and could be a huge part of our economic development for Southwest Wyoming. So I would love it if you guys would just consider it for a year to see what we could do with these buildings.
Thank you, Mr. Lynn. We appreciate it. All right, let's, next. And so once again, I want people to fill the chairs and we'll go down the line. So that then we can, we'll move a little quicker because we're losing 30 seconds right now as we're shifting chairs. So the first one seated is the first one that's going to talk. All right, go ahead, please.
Thank you, Mr. Chairman and members of the committee. My name is Nate Martin. I'm the Director of Better Wyoming. We appreciate the work that you're doing and the time that you're giving us. Not everybody's going to speak today. It's just going to be us four.
You're the director of what?
It's called Better Wyoming, and we have a copy of all of the testimony to LSO staff that you all can have.
Okay, go ahead, please proceed.
So we're a statewide nonprofit that goes and talks to people and communities across the state to find out what problems they're facing, identify common issues among folks, and then organize people on behalf of statewide solutions. This
Okay,
often
keep talking, I'll get the phone.
involves talking with state legislators. We're grateful that Representatives Larson and Sherwood and Senator Anderson have recently agreed to meet with us and that you all are taking the time to hear us. For 5 months in 2023, we went around the state talking to people about healthcare. We gathered input from nearly 500 people via online surveys, phone and text banking, in-person healthcare summits, and we identified 4 issues that are major priorities when it comes to healthcare in Wyoming: affordability, a lack of healthcare providers, mental health, and distance to care and transportation. Each one of these topics is big and complex without a single silver bullet solution, but you all have in front of you a decision that affects each and every one of these areas, the amount that the legislature will appropriate to the Department of Health. Now, we are not budget experts, and I apologize if some of the folks who are contacting you have misunderstood the situation, and I thank Representative Larson for that explanation. We understand that the Department of Health was significantly cut a few years ago. Those were backfilled by federal funds. And we know that the Department of Health has requested that its budget stay relatively flat despite a significant budget surplus. Finally, we are, I think, understanding that the governor has recommended $20 million less for the Department of Health than the Department of Health asked for. Is that, if we misunderstand that, we apologize. But what we are here to ask is that you all fully fund the Department of Health's budget recommendations, and my colleagues here will articulate why we think that.
Okay, perfect timing. Next.
Thank you, Mr. Chairman, members of the Joint Appropriations Committee. My name is Angela Sylvester. I am one of the organizers with Better Wyoming. I also work as a wraparound provider for the Children's Mental Health Waiver under Wyoming Medicaid. As an organizer with Better Wyoming, I have talked with hundreds of people about healthcare and what it is lacking here in Wyoming. The biggest issue we have identified is affordability. This issue affects the tens of thousands of people who do not have any health insurance coverage. These people often cannot afford healthcare at all. However, the issue of affordability also impacts people who do have insurance, but find their deductibles and premiums are too high or who require care that their insurance does not cover. The Department of Health budget that you are considering includes funding for several programs that directly affect me and my family. Without them, affordability would be a huge issue for us as well. My son is disabled and he's on the developmental disability waiver with Medicaid. This program means a lot of things for my family. It gives my son some independence away from me, and it also gives me some peace of mind that there are good people taking care of him when I can't. The program gives me some freedom and independence as well, and the ability to work. It would be extremely difficult to keep a job without the support I get from the waiver program. I am a hardworking single mom, but I would never be able to afford the kind of care that my son receives, even with insurance. Working for the Children's Mental Health Waiver, I get to pass along some of what I have learned navigating the healthcare system here in Wyoming to people who could not otherwise afford mental health care for their children. There is a great need for these programs that give families like mine a lifeline when we need it most. But they are not the only programs in the Department of Health budget that hardworking Wyomingites rely on. For instance, 1 in 3 births in Wyoming is covered by Medicaid, and these new moms depend on health coverage from the extended postpartum program passed last year. For these and other reasons, we ask you to fully fund the Department of Health's budget request. Thank you for your time.
Thank you. And just so you know, I have a disabled son as well, and I'm on the board of directors of Magic City here in town, so I understand what those issues are. So go ahead, please, and introduce yourself.
Is it on?
You're good.
Okay. Thank you, Mr. Chairman and members of the Joint Appropriations Committee. And my name is Phyllis Roseberry. I live in Worland. Actually, we live on the Gooseberry Creek cutoff between Worland and Meeteetse. We've lived there for 40 years. And I'm a member of Better Wyoming, and I'm on the Washakie County Hospital Board. Across Wyoming, one of the biggest healthcare related issues people face is a lack of providers. This includes specialists, quality general practitioners, mental health providers, nurses, dentists, and medical professionals in general. The problem not only exists in rural areas like the Bighorn Basin, although these tend to be the areas where it's worse. Without adequate healthcare providers, Wyoming residents too often lack the freedom to access the care that they need. I have participated in many discussions on the hospital board about the difficulty of recruiting qualified staff for our hospital in Worland. For instance, Banner Health, which operates our hospital for the county, has opted to use traveling nurses and doctors to fill their personnel needs since we lack local providers. This is a very expensive option. Permanent RNs earn about $72,000 a year, according to labor statistics, and traveling RNs earn $100,000 a year. These extra costs must be passed on to patients, or the hospital's bottom line suffers. As a result, the problem of affordability that my colleague already discussed becomes worse for our patients. For this and other reasons, Banner reports more expenses than income almost every month. I was kind of shocked by that. They're always in the red. How long can they maintain a hospital that operates in the red? I mean, I asked them that. I was worried that we're going to lose our hospital. What would Washakie County do if Banner left? Who else would operate this rural hospital, which is a pillar of our community? This is a dilemma facing many rural hospitals throughout the state. We depend on the Wyoming Department of Health and its programs, both to continue operating and to find permanent solutions. For example, the Department of Health's Healthcare Workforce Development Program helps train local healthcare workers, which is great, so that we might one day not rely on expensive traveling doctors and nurses. This year, the department requested additional funds to expand its workforce development efforts in the form of tuition reimbursement and paid leave for certified nursing assistants to become registered nurses on the condition that they stay and work for the agency. This is exactly the kind of program we should be funding to expand our pool of healthcare professionals in Wyoming. We must maintain quality and affordable healthcare in rural Wyoming. People turn down business opportunities and jobs in our area because healthcare is so expensive or unavailable. In fact, we have 2 sons. Luckily, they got jobs in Wyoming, which had healthcare because their wife said, "We're not coming to Wyoming if we don't have affordable healthcare for our families." So
Okay, your time is up, so can you conclude?
It just stifles the economy. Thank you.
Okay, thank you very much. Please, proceed.
Mr. Chairman, members of the Joint Appropriations Committee, thank you for the opportunity to speak with you today. My name is Kim Bartlett, and my husband, John Fenton, and I traveled from Thermopolis to share some local concerns and ask you to fully fund the Department of Health's budget request. We are small business owners and active volunteers in our county, which boasts the oldest population in Wyoming. Like many people in Wyoming, Thermopolis residents often must travel long distances to access care. This is a serious challenge for seniors and people who do not have reliable transportation. It's a burden for working people, and it adds significant costs for anyone seeking health care. Thermopolis is lucky to have Hot Springs Health Hospital and Clinic, which is county supported. We have a fantastic hospital administration, staff, and providers who work hard for our community. But like other small Wyoming hospitals, ours loses just over $1 million a year on average in unreimbursed healthcare, mostly from uninsured people who can't afford to pay out of pocket for treatment. The problem of having to travel long distances is, in many cases, the result of a lack of healthcare providers. Hot Springs Health CEO Scott Alwyn says our hospital's biggest provider issue is a lack of a behavioral health provider. Due to the low Medicaid reimbursement rate for mental health professionals, we have been unable to retain a provider with devastating results. Last April, we lost 2 young people in our community to suicide, a 16-year-old and a 19-year-old. The latter had sought help, but the options at the time were insufficient to meet her needs. The community has been devastated by these losses. Struggling with illness is always a challenge, and the fact that people in our community must travel great distances to access health care makes the struggle much more difficult. Our local senior center works hard to transport patients to Casper and Cody on a monthly basis. However, we have elderly persons in our community with kidney issues who need dialysis 3 or more times per week. While our hospital provides our community an amazing array of resources, dialysis is not one of them. Therefore, people who are unable to travel try to manage kidney disease on their own without the freedom to access the treatment they really need. Our hospitals, clinics, and healthcare providers are already woefully underfunded. Please seriously consider fully funding the Department of Health's 2024 budget request. Wyomingites deserve a healthcare system that meets all our community's needs. Thank you again for taking the time to listen to us today.
Thank you very much. Okay, we appreciate your coming all the way down here. And trust me, if you want an advocate, he's sitting right here, so you don't have to worry.
We are very thankful for
Okay.
Representative Larson.
Sure.
I just want to thank you again for the time and for listening. You know, we've got hundreds of people who are interested in this. And one of the reasons that the Department of Health budget galvanized so many people who are interested in healthcare is the fact that 90% of its budget is passed through to local communities in the form of services and programs and reimbursements. And if you go and talk to people around the state, the overwhelming message is that we need more resources in our healthcare system, not fewer, which is why we're here making this request. Thank you very much. And if you have any questions.
Okay. Okay, whoever's next, come on up. Please identify yourself and go ahead.
Anderson. We're here to talk to you about rural schools today.
Okay.
We're ranchers in Garrett, Wyoming, and we live in northern Albany County. We have 2 children, Emmett, who is 7, who's our little cowboy, and Waverly, who.
We have pictures of your family and we've
Okay.
had discussions with your good Representative Sherwood, so.
Okay,
Go ahead.
so we will just get in. We're asking today to help fund rural education in Wyoming.
There are several options to pursue in obtaining funding for rural schools. Through a legislative bill to set up a special fund for rural education for families or communities to meet the requirements. 2, the legislator could amend the budget to provide the required funding. We want the legislators to help protect rural children and their education in Wyoming. Also, we were thinking maybe there could be an opportunity to look into having mobile homes or buildings to be used as classrooms and housing for the teacher. This is how it was done in the past. After one school was used, it was moved to the next family. We have seen that the school district in the past have left buildings behind or abandoned them, which cost taxpayers more money. Purchasing and reusing buildings and holding the districts more accountable is a more viable option in the end. Rural community children are equal to in-town children. Both need a safe and local education.
And I will save you the long speech about that. So our backstory, we have numerous articles. If you guys could read them, we would appreciate that, but it'll save a lot of time. Go ahead, honey.
In our letter that the state superintendent denied our school,
One second, go ahead.
he stated,
Hold on,
sorry,
hold on.
We just want you to know that this is really important for us to hear. And don't feel like you're imposing upon it. I know you're nervous.
Yes, sir.
And we get that, and this is important to us, so.
Mr. Co-Chairman, and also Representative Sherwood has really been advocating on your behalf and has made sure that we've seen photos of your family and has referenced those articles that we've seen in the newspapers. And so
She's the best.
we are familiar with your story, but we are happy to hear from you here too
And
today.
we've sat around and tried to brainstorm possible solutions. Go ahead.
Thank you. In the letter, the state superintendent used taxpayers' dollars to justify the denial of our rural school. However, we are taxpayers too. We pay taxes on our buildings, on our land, and our personal properties. We also pay the state lease for school sections, and there are 16 school sections in our community. We are expected to be okay with our tax money going towards $30 million, $60 million schools in town. But when we ask for 1% or less of that for a rural school for all children, we are considered a burden.
We know that virtual learning is an option. And we know that COVID has kind of proven that children do not receive a good education just watching a screen all day. We feel that virtual learning the children don't actually learn and teaching and understanding the subject like they do with an in-person teacher. And we also, here we go, I got this. We also, homeschooling is a good option for some families, but on a remote ranch, we feel that both parents were working, just like parents are working in town, teaching and monitoring children while running a ranch. That is our livelihood, is not a viable option for us right now. I know in my heart that I don't have the skill set to properly school my children. And I feel my attempt at homeschooling deprives them of a quality education. Sorry about that. How is it possible? I have no formal training to homeschool my children. And we feel that teachers have an opportunity to shape young minds for a lifetime. We believe the impact to expose our children on an outside perspective with a varied life experience. A good teacher can make all the difference for a young child's impact and have an impact on them, and that'll last a lifetime. So please think to yourself of a teacher that has inspired you when you were a kid. I guess that's just what we want for our kids.
In a rural community, one parent and the student shouldn't be forced to move to town and separate the families. This is not conducive to a healthy, happy learning environment or family environment. It is not a plan when families must live in two different places without access to both parents. Forced to drive back and forth for the entire school year would further push us away. Being on the road 2 to 4 hours a day is not a good life for a kid, and also would take time away from our ranch to properly get our work done. Also, the safety factor. We can't expect a school bus driver or our children to be out in the winter on these roads when in an instant it could be packed full of snow and the wind makes no visibility at all.
We realize that some districts around the state might not be able to absorb the cost of rural schools. In those cases, it would be helpful for the state to provide some money. If there is a special funding set aside for rural schools, there could be a step-by-step criteria for parents and the districts to follow. Examples would be safety, isolation, extraordinary circumstances whenever a rural school is needed in the state.
Okay, you're taking other people's time.
Okay.
But anything
All right,
else?
we will finish, you finish with, how about right there? And then I'll.
If we have extra time at the end, you can come
Okay,
back.
well, I'll finish with this. The Declaration of Independence says that the government is instituted to secure life, liberty, and the pursuit of happiness. The Wyoming Constitution says that rural children have the same rights to a free local K-9 school as those in Cheyenne, Casper, and Laramie. Our children are worth it, and it is a way of life as we know it depends on this rural school. My husband and I would like the same opportunities for our children as others have. We also, along with our neighbors, would like to see our tax dollars used to educate local children.
Well, we feel your
And-
concern and your pain. We really do. So,
Okay.
Thank you for your time.
Very much.
Thank you.
Okay, next. Any other folks? We got a room full of people. Oh, please come on up. And anyone else that wants to speak, come up and take a chair.
My name is Holly Gerard. I'm retired. I've worked at a variety of jobs in Cheyenne. I've been here 20-some years.
Can you get a little closer to that mic?
Okay. My name is Holly Gerard. I'm lived in Cheyenne for like 23 years roughly. And I'm a parent of a suicide victim. Wyoming has the highest rate of suicide per capita in the country. I just want to make sure I'm just speaking extemporaneously, so I don't know what's in the budget right now concerning funding the 988 hotline. I'd just like to say I'm supportive of that because we need to do something about suicide rates in Wyoming. So I hope that that's a consideration. Thank you.
Well, thank you very much. We're on that path. Okay, anybody else? Done? Online folks?
Mr. Chairman, you do have 4 online and they're being brought in right now.
While that's happening, if anyone else wants to come talk, come on, have a seat up here. Okay, welcome. We see Kurt, are you up? I think you're muted. Someone speak and whoever speaks first will go first.
Hi, my name's Elena Campbell, Mr. Chairman, Madam Co-Chair, and committee members. Thank you for having me. I am a maternal child nurse and have my master's in business, longtime student of macroeconomics. My great-grandfather's John Kendrick. He was governor of this state and he was a 3-time U.S. senator. We live in the best state in the union. I'm going to be on a little bit on the other side of the aisle, and I listen and realize how difficult it is to prioritize, but I am terribly afraid our country is in a lot of trouble right now. The U.S. debt has exceeded now 34 trillion. We're paying over $1 million per annum in interest. People, as a result of that, are losing interest in continuing to purchase our U.S. debt unless we pay a lot higher interest rates. We've seen the fallout from that. The private sector is not doing well. We've lost well over 3,000 retailers, lots of lost jobs. Our savings are at an all-time low in this country. Our credit card debt is an all-time high. So private sector is having a really tough time. Inflation, everybody is having to cut back and struggling. We're all familiar with the 3 Ds. We have debt, we have deficits, we have debasement of our currency as a result of those. That's the monetary or price inflation that we see. But now we're looking at a 4th D, and that is de-dollarization. Again, people are moving away from the US dollar. The BRICS nations, Brazil, Russia, India, China, are all starting to transact amongst themselves. We're losing that reserve currency status. Complicating this is that Saudi Arabia was one of 6 nations to recently join those BRICS nations. They were the last holdout for the petrodollar agreement that we have. Again, that is our reserve currency status. We're losing our ability to export all that debt. Fiscal responsibility is going to have to come home. In the meantime, I'm not sure that Wyoming can at all rely on the cash flow from the federal government. We have to become more self-sufficient. And so as tough as it is for the state of Wyoming, for you legislators to, I mean, these are really tough situations. I am a maternal child nurse. I get it. But stress events are likely. We heard that testimony this morning. Craig just lowered its estimates. I suspect you're going to be seeing more of that. So please look at Wyoming's size, spending, and commitments. Fiscal responsibility, self-sustainability has got to be the name of the game.
Thank you
Private
very much. That's 3 minutes. All right.
Okay, private citizens are hurting. It's time for the public sector also to pull back. Appreciate you guys very much.
Thank you for your testimony. Okay, next, I can't read it from there. Oh, Bruce, go ahead.
Thank you, Mr. Chairman. My name is Bruce Berkland. I'm the Executive Director for the Wyoming Youth Service Association, which includes programs for crisis shelters, group homes, residential treatment centers, and BOCES. Our members provide a continuum of services from prevention to residential treatment to help address mental health issues for youth and their families. We greatly appreciate the increase in the governor's budget and the governor's budgets for many of our programs. But as Director Schmidt has said, and the Guidehouse study has shown, the gap between funding and cost for those programs is large. And supporting the full exception request proposed by DFS will significantly enhance our ability to improve access to care and prevention services for Wyoming's youth. We request that you fund the full request by the Department of Family Services. Thank you.
Thank you very much, Bruce. Appreciate your testimony. Anybody else online that wants to testify? Anyone else in this room who would like to testify? Come on up again. We don't want to chase anybody off too fast. Okay, I don't see anyone else or any hand raised on the screen, and no one's coming forward. So with that, we will close public comment. Thank you all for being here and paying attention to the monotonous job that we do for the last 2 weeks and 2 weeks in December, and then another week before session, and then through sessions. So we hope that we make you proud. Thank you very much. All right. Don, any updates or final tidbits before we adjourn for the weekend?
Mr. Chairman, I do not.
Okay, with that, we will be adjourned until Tuesday at 8 o'clock.